Okay, and then down. And now do the other side. It's moving pretty good, but to you that feels very heavy,
I'm like really.
straining to do it.
Uh-huh.
And your foot's all kind of
Yes.
coming in. Okay, so now we're gonna notice in a minute, if you try and pick your foot up like this, like that, can you do that over here? Pretty good. Doesn't come up as far, but it's moving
I'm
pretty.
using my knee to do it.
Okay. And if you had your husband or someone here, what I usually do is I tell someone to grab your ankle and pull it down. So if you bend this leg up again, and now I want you to fight me, don't let me pull it down, it's pretty easy for me to pull that down. It's weak. Try this side, all the way up. And this side is not, it's stronger, but this side I don't have as much resistance. So we're gonna see in a few seconds how easy it is to change all that, make that all move easier for you. The leg will feel lighter and easier to move. So this is a big chunk of ice that we make by putting water in a yogurt cup.
Okay.
And then I'm gonna use the ice, and I have this all written out for you, but I'm gonna use the ice right down the outside of the leg and on the top of the foot, but I will not put it on the big toe.
Okay.
I also, if I put my hand, I'll only put my fingers underneath your toes. I won't touch the bottom of your foot, and we'll explain why. So this is just ice. And when I put the ice on the outside of the leg, and what's happening with your foot, you feel your foot coming up when I do that?
Yeah.
And are you trying to do that, or is it just happening?
It's just doing it.
It's just happening as a reaction, right?
Right.
And that's an area where, how many years ago did I show you this? And you don't remember?
No, I don't.
A long time ago. So now, after I did that, the skin, I didn't freeze it, but the skin is cool. So research says if you drop the skin temperature 10 degrees, you fire 90% of these. This is a vibrator. Feel it with your hand. Very intense. Come along with a vibrator over the same area. Toes. And interestingly, and now, let's see you move your leg up.
Oh my God.
What happened?
Like it was easy to do.
Well, good. So you feel stronger.
Wow.
So again, if I give, this is sensory input into this little area of skin, and bend your knee up again now, pull up. Now I want you to hold and fight me. Hold it up. Hold. Feel that strength?
Much better, yes.
A lot stronger, huh?
Yes.
So that's something so simple
Wow.
to do, and move your leg up now. Like a lot lighter, huh?
A lot lighter.
Okay, so, and how many years has it been since you felt lightness like that?
Oh.
You got the ice got you a little wet here. But, so you have antenna in your skin, sensory nerve endings. And Charles Sherrington was a British neurologist in the 1930s, 1929, who won a Nobel. And he found out that nerves are classified by how fat they are. So the fatter the nerve, the bigger the message, the more faster the message travels. And so forever, people have wondered about how to get a dropped foot. This is, a lot of people call that a drop foot.
Yes.
It is not a drop foot, because a drop foot by definition is where you injure the peripheral nerve, and that's a foot that you pick up and it just flops. It's like a dead foot. And that happens, but that's not what MS patients have. You have a spastic foot. And so, not to play games with words, but there's a huge difference neurologically between the two. So Sherrington found that the alpha motor nerve is what is wanting that leg to go stiff like this, makes your knee bends, and when you walk, your knee locks out, your foot wants to go down, your toes curl, and that's all part of a extensor thrust reflex. And it's an anti-gravity muscle. So the anti-gravity muscles are the ones that you fight gravity with, and that's why the muscles that you push down with have more tone in them.
Okay.
The anti-gravity muscles are the ones that pull the knee up and the foot up. So we're trying to stimulate the anti-gravity, the ones that, you know, you have a hard time moving. So Sherrington found out that there's a little skinny nerve called a C fiber. And the C fiber nerve is a sensory nerve. There's intrafusal muscles and nerves that are inside the muscles of the leg, and then there's extrareceptors, muscles on the outside in the skin. And they tell us all kinds of information. You know, you can tell if it's hot or cold, sharp, dull, soft, all that information. In the palm of your hand, you have a lot of nerves. On the back of your hand, it's pretty stupid compared to the nerves on the palm of your hand. Well, the bottom of your foot is loaded with nerves, like the palm of your hand. So when the nervous system gets in trouble, we have a lot more antenna sensory feelings on the bottom of our foot than we do on this dumb skin up here.
Okay.
So that's why we use the ice to take that dumb skin, and it goes straight to the brain, this
Okay.
signal from the ice. And so Sherrington found out that the C fibers, one little C fiber can't possibly shut down the message of an alpha motor or an alpha sensory nerve. However, what his genius was figuring out that if you ice over a large area, that's called a dermatome, you can summate or add up all of these little C fiber extrareceptor messages, and that's what shuts off the alpha motor and why you felt stronger
Yes.
and why the leg feels lighter. So another thing that you can do if you're out walking through the mall and your leg gets tired and stiff, you can take your hand and just slap the foot like that. See the foot come up?
Yes.
And I'm not really hurting you.
No.
The sting of it, the sensory information makes
Gets
that
it
foot
to
come
go
up, okay? Now, if you were, when children are born, they have all these primitive reflexes that are normal. But as we age, our nervous system grows and matures and we don't have those reflexes anymore. So a little baby, if you put your finger in the palm of their hand, they close it. But after our nervous system grows and matures, we don't do that anymore because we shouldn't do it. But when we have some neuropathological stuff, we start having these older reflexes come back. And you're not in that bad a shape, but every day you ought to be doing the ice and vibration along here. It can't hurt anything.
Right.
So again, we don't want to touch the bottom of the foot because there's too many nerve endings there. And that's why MS patients say, the more I walk, the tighter I get. Why? Because you put the information into the skin in the bottom of the foot, and it's not being inhibited.
Okay.
So that's why you progressively get stiffer. So one of the answers to that, if you're outside, you don't have ice, you don't have a vibrator, you can just do that. See your foot come up?
Yeah.
And what that does, it changes. So now when you bend your knee, it still feels nice and light, right? So,
Wow.
kind of fun to learn about, huh?
That's like unbelievable.
So do you have any problems with, let's just see with this leg, in case you have some symptoms. This is your so-called good leg.
Good leg, right.
I like that leg just as much. It's just that someone never showed you this stuff. So again, it's just ice, and I'm gonna use it on the outside of the leg and the toes. So if you've got this leg, and then we need to talk to you about your balance, because almost every MS patient has balance problems, they think, and we can show you that you don't really. So let's just see what happens over here. So not bad, a little bit of reaction here, but not like the other side. So bend that knee up now, see, does that feel any different?
yeah.
That'd feel lighter
I mean,
too,
it does feel,
lighter. So even though this is your good leg, there were some symptoms over here as well. So when we did the ice and vibration, it all of a sudden feels lighter.
right.
So now you got twice a good leg and
Yeah.
another leg that you can realize you can do something about now. And of course, if you want to exercise and build power, then you find you do your ice and vibration and do what I just did. I had you pull this leg up, so bring your knee up on this side, and now hold it, and then I'm going to pull, and that way I exercise the muscle that does what? Pull the leg up. And then there's a natural consequence of our muscles. If I can find a way to make a muscle contract, I automatically inhibit or shut down the tone in the opposite muscle. That's a rule in
Okay.
neuroanatomy. So when I give you exercises pulling down, I shut off the tone that makes this leg stiff. The worst thing you can do is get on a bike and push and build the muscles of extension. Why? Because you're feeding the tone. So that's contraindicated in your type of case.
So like I do elliptical all the time. Is that not a good idea?
You don't, well, elliptical, getting range of motion is one thing, but in terms of trying to develop muscle power, you have neuropathology. So we want to isolate our exercises by only working with the muscles of flexion right now, because they're shut down. That's why this leg felt heavy. And this leg was biased because the more that foot's on something and you're pushing down, you're turning off the muscles that are weak even further. So you're just gonna change what you're doing. The exercises are gonna be specific to your problem. The next thing you know, you'll be picking those legs up a lot easier. Do you have any trouble with your hands at all?
You know what, these two fingers, I do have problems with.
Okay,
So,
so
like I've noticed with the computer, I always just use, and I'm right-handed.
rub your hands together like that. Do they feel the same or different?
This one is more sluggish.
Okay, so let's just see if we take some ice and wake up some nerves. I'm gonna put this towel so I don't drip water all over you. And we're just gonna take this ice and place it inside the palm of your hand, like that. I'm gonna try and get it in between your thumb and finger. So we're just holding that like a, and tell me when that gets nice and cold. Pretty cold?
It's pretty cold.
Yeah. Okay, then we'll dry your palm off. And now, look how that hand opens. And let's see if I go along the muscles that would naturally open your hand or on your forearm up here. So I'm gonna use a little ice like that and use it on the back of the hand. So this cold just actually stimulates nerve, right? So we'll dry that off. And then we'll come along with the vibrator again. And you can take a stroke patient with a closed hand and do this and the hand will open right up. So when I do this, this is vibration stimulates proprioceptive nerves. So I'm just going in here and giving you, and now move your hand, see what that feels like. Feels easier.
Yeah. It feels
So this
easier.
is nerve food.
Wow.
If you rub your hands together now, they feel different, yeah?
Okay. Wow.
So, somebody should have taught you this a long time
A
ago.
long time. Okay.
So it's just, and you can see the difference in the size of this leg and that one just because over the years
Yes.
you've had atrophy. So it takes a little while to build the atrophy, the muscle back up, but there's no reason you can't.
Right. Plus I have swelling on each side, so I don't know why. I have swelling on that side.
Over here.
Yeah.
Um,
Yeah.
the other thing I want to do is talk to you about your balance. So we can just stop the